So you talked about bioidentical hormone replacement therapy. Like, I want to, first of all, I talk to me like I'm a 5-year-old. What is that? And why is it superior to just like, here's some progesterone, lady, get out of here?
So the bioidentical is a marketing term. So, we basically it came about after that study. So the people that recognized the study was bogus and that we were, demonizing something that shouldn't be demonized. And as Mark Twain said, by the time the truth can get its shoes on, the lie is halfway around the world, right? So this is exactly what happened with hormone replacement therapy, that nobody could really get the information out in time. The media had taken it over. All doctors believed it. And then all women were like stopping their HRT overnight. And this is like extreme. One of them there, I'm surprised there's not, I think there's like maybe a documentary, but it should really be talked about how devastating this was for women's health. So, and we spent $1 billion worth of funding on this, for example, too, like of taxpayer dollars. So the bioidentical thing came around because of that. So the bioidentical word just means that the hormone, the chemical matches the identical, like it matches what your estrogen looked like, right? As close as we can get it so that it will bind to the receptor and have the same signal. So when we look at like something that we distinguish it from synthetic, because synthetic just means like the birth control, the fake hormone, like the fake chemical, that it still binds to the receptor. But when you have like receptors are not your body is extremely intelligent. So if it's not the same thing that's binding to the receptor, it's going to behave differently, right? Duh.
Right.
Like, I mean, but if you talk to doctors and pharmacists, they're like, oh no, it doesn't matter what binds to the receptor, but it does. So like progesterone is our natural hormone, but progestin is the synthetic one. Of course, they named it very close just to, again, confuse everybody. And so the two, it's really important that women know that when they use the word bioidentical, they're just trying to tell you, I've not chemically modified this. I've not changed it in any way. It's literally the naturally occurring molecule. And it's important because you can't patent something that's naturally occurring in nature. So big pharma is never going to like touch it because it's like they can't patent it. So and then the FDA, like, there's also, we have a process for approving patented things, not naturally occurring things, just like those. So the system is set up for failure, right? So anyway, I could go on and on. But the point is that like women, if you're just looking, if you recognize the word bioidentical, then okay, this is like what's matching my body and you're trying to mimic what my body is doing.
So we should assume that that is the superior of the two
Well,
choices.
I think you're going to get a better result. So
Okay.
if you look strictly at studies, the synthetics are probably safe, but it's like, and they're probably like they might work. But I think in general, I would never take something that was synthetic, and I want to feel most like myself. And I think other women feel the same way. I want to take, I don't want a chemical in my body. I'm tired of all this chemical stuff,
Mhm.
and so I think that you're just going to get a better result. And I think it's obvious that women are gravitating to that, and they should, and they deserve it. So I don't think there's any question anymore about it. Most doctors who do it and do it right are doing using bioidenticals.
Okay. So your product consists of both progesterone and estrogen in the bioidentical form. Is that correct? I just want to make
Yes.
sure I'm okay. No testosterone.
So our bodies, so testosterone has been a major focus, which I think is great. Like we need testosterone. There's going to be a lot of people upset. They get upset when I say this, but it's like, I don't inject men with estrogen. Okay. So like when men come to me and estrogen we know is extremely protective for men. Hey, makes your skin and hair look great. It's going to protect your heart. It's going to actually probably suppress your appetite, make you lose some weight. But I don't inject them with it. And it's not the first go-to thing I go. I just make sure that it doesn't get too high. We just kind of let them make it. Women, like it's our first go-to and we say that your testosterone is low, and we inject them with testosterone or give them a cream, or like we have the potential to make them pretty imbalanced and testosterone dominant. So
Okay.
they could get hair on their face and acne and lose their hair and get bloated and gain weight. So, and it's okay. Some women love it. That's what they're on and they love it. Great. I'm glad that you found what works for you. But for a lot of women, especially younger one, it's like not necessarily the first hormone that you should go to, right? It's kind of like that. I'm not just going to give you progesterone and just full force give you the one hormone. It's the same concept of like, why are we doing one hormone at a time when we know that you need all three? And if you're low, and so anyway, progesterone converts to testosterone in women. So you can kind of just give her enough progesterone and she'll
Okay.
make some testosterone. So like, but if it's not high enough, like the cream, if you want yours a little bit higher, this is hard too because some women like it higher, some women like it lower. This is where you can individualize it, make it more custom. This is where you can say, okay, we didn't get your testosterone quite where you wanted it to be. What can we do to raise that? And there are ways that we can raise it.
So are we talking about a personalized approach to HRT? Like we're saying that my HRT is going to be different than yours and hers, and we're going to be receiving different things based on our different needs?
So there's like a really strange belief that that's the way it should be. Like we don't do anything in medicine like that. Like you don't get a different dose of anti-anxiety med than your friend or someone else. And then even with men, all men get the exact same dose of testosterone in the country,
Okay. Yeah.
exactly the same thing. And even with the current HRT regimens, it's all the same dose. Like everybody gets a 200 milligram of oral progesterone pill and a zero point 0.5 of pat or whatever, right? They have their like set dosing. So it's like this kind of misconception that you would need something so radically different,
Yeah.
right? Like, so I think what is personalized that definitely needs to happen is like your journey is going to be a lot different than an endometriosis woman who's 25 or a 55-year-old menopausal woman, and your needs are going to be different just because like of your age, different age and different history, but the concept should still be the same. You don't need like you don't need just need progesterone and then a menopausal woman needs estrogen. You know what I mean? Like everybody
Yeah.
needs all three hormones. Everybody needs them to be in the right ratio. Everybody needs them raised. But like whether you start something and you have problems versus your friend who doesn't and needs some different, you know what I mean? Like so it definitely has to be personalized in that sense at all times, because no two people are alike. But to believe that like I need to make yours 0.25 milligrams of estrogen and then she gets 0.23 milligrams of estrogen, it's like doesn't make like why would so you know what I mean? Like we need to just like work on getting you. You're here. You're at zero. You're at the very bottom. I'm going to work on getting you up a little bit higher. Like right. So then I'm and let's start. Let's just focus on getting you a little bit higher and see how you feel. But women come in the gate like I want something totally individualized for me, and it's like you're not feeling so great. Why don't we just work on this first, right? Like let's just raise you up. Let's just see how you feel. Let's see how you do. Like just trust me a little bit on the process. And then we can start working on optimizing or personalizing you. But I don't know. I cannot I'm good. Believe me, I'm a good doctor and I've been doing this for a long time. I cannot predict what your optimal dose is going to be. Like no, there's no lab test that's going to tell me that. There's no magic crystal ball that any doctor has that's going to be like, yep, you're going to do amazing on this dose. Like there's nothing, right? So like I got to get you started on something and then I work. That's why it's called a relationship, doctor patient relationship, because you're going to give me feedback. You're going to tell me how you're doing and then we can make adjustments. So it's kind of like this work in progress. And I tell women that look, it could be a 6-month journey where we need to get started on something. I'm going to take you from zero to like make you feel better and get rid of a lot of your symptoms. And then let's work on optimizing you. How's your skin and hair look? You know, do you have acne still? Is your libido still low? Do you still have some brain fog, right? What's still going on with you at month 4 that we need to keep working on? Do we need to raise your dose? Do we need to low? Like this is where you can keep optimizing along the journey. And so if women understood that it's the first 3 months could be about healing, like you have to heal your gut and your breasts and your uterus and like help your body. And then after that, you could start optimizing libido, weight loss, you know, like some of the harder things to get.
Awesome. Okay, so we're gonna know. We're gonna get we get the baseline, and then we're gonna be able to know based on how we feel. This is a very radical concept you're saying too. I mean, wait a minute, hold on.
You
Like
mean
I actually know how I feel.
women have to listen to themselves and like turn inward a
Wait,
little bit and like just pay
hold it.
attention to like
Don't be getting crazy, lady. I mean, I need to ask you how I feel. You're the
or a lab
doctor.
test. The lab test has to
Yes.
tell me how I feel. I love it. I'm like, why would the lab test know better than you? And they come back with a lab test, and I'm like, put the lab test down, and I'm like, okay, well, how do you like your labs could be completely normal, and you could tell me that you're still miserable. And if I just was like, well, your labs are normal, like that, well, I wouldn't be doing anything for you.